In this video, I just want to talk a little bit about what I think would really help make healthcare work much better for rural people in the United States, people who live in rural areas and small towns. Um, there are some realities that go with small town life and the fact that there are so many square miles in the United States. We're not a compact country like the United Kingdom or France or Switzerland or Germany. Our population has areas like New York City or Chicago or Los Angeles where the population is much more condensed. There are far more people per square mile. But in our rural areas, there is not that population density. And the reality is that healthcare, especially when you look at reimbursement, there's a certain level of volume that you need. You need to see a certain number of patients regularly to get the kind of reimbursement that would enable you to invest in infrastructure, diagnostic equipment, lab equipment, and things like that. And the reality is in small town rural areas, there's just not that level of population density that can get you the volume. When you've got a lot of volume in any business, when you have a lot of volume, you can do well with a smaller margin. When you don't have a lot of volume, then you need a larger margin in order to be able to keep investing in your company and being able to stay up to date in things. And you often see in smaller areas, people often comment, look how small town America, rural America, it's all worn down, it's broken down, the infrastructure isn't working. Well, many of those places have seen their heyday back in the 50s and 60s in population, and ever since then, the population has been dwindling away. And a lot of the infrastructure, like hospitals and schools and all those kinds of things, were probably built in the 60s, 70s, maybe 80s, but now there's just not the resources in these rural areas to do things without outside help. And that's the same with healthcare. So it's hard for a rural area to do things without help. And one of the big struggles that rural areas, small towns have is recruiting healthcare professionals because there is no advantage financially to go live in a small town. If you're a doctor, you graduate medical school. In fact, most of them can make 3 or 4 times as much in the suburbs or in the city or in a city hospital. Coming to a rural trauma for hospital is not going to provide the same living for the doctors. And I think one of the biggest ways I think we as a society can help rural areas is to get rid of this kind of the idea of just this universal reimbursement that in certain areas, there should be an augmented reimbursement so that doctors that are in small towns, that are in rural areas that maybe are not seeing the same volume of patients can still take care of the medical needs in that area, and through higher reimbursement through like Medicare, Medicaid, would be able to have a okay standard of living for all the money and work they put in getting that training and paying off their medical bills. There are programs if you go to underserved areas where you can get your medical school paid off, and that's great. But those usually end after 6 years. And what I've seen being in a rural area is we see these new doctors that will come, they'll work their 6 years to get rid of their medical debt, and then they're gone. They don't stay long term. And we've got to find a way to keep doctors in rural and small areas longer. And I think by increasing reimbursement rates to give a special augmentation in certain areas, where we want people to stay, that doctors can go and say, hey, I can work in this small town, this rural area, and I can do okay. Just so you understand, a lot of doctors that are working in small towns and rural areas will have their clinic. Then they'll go from that job, and their next job may be as an attending physician in a rural hospital, and another job may be as a medical director of a nursing home, and another job may be a supervising medical director for a hospice. And you see many of these small town doctors, in order to maintain a standard of living and pay their bills for all their clinic staff, pay their insurance, pay their medical school off, and all that, they are having to work so long, so many days, working night and day, and it's just brutal on their families. And anybody that wants a decent quality of life that's a physician, it's very hard to do that in a rural area, especially when you look at the expenses that are brought on by medical school. And yes, being somewhere and having those school loans are paid off is great, but it doesn't cover all of that expenses of the training and everything. It's just very hard for physicians in rural areas. And it's very hard to attract people to stay, especially specialists who might otherwise be attracted to small town life. The sacrifices sometimes are just too much. And the same is with all sorts of other healthcare professionals. And maybe even the playing field to account for the lack of volume of patients that one might see in an inner city or suburban hospital or clinic, if maybe offset that a little bit with Medicare and Medicaid, it might just tip the scales enough to get a few more interested in working in rural areas. Another issue is getting equipment, having equipment places, diagnostics and things like that. A lot of people have not only the expense of whatever their insurance expense is, if they have third-party insurance, co-pays and deductibles such as that, but if you live in a rural area and you've got something going on and you see your doctor says, I'm going to refer you to a specialized clinic in the hospital in the city that's 100 miles away or 150 or 200 miles away, then you have the expense of gas. You may or may not, and many people in rural America aren't driving the latest, greatest cars, many thousands. They're driving old vehicles, may not be able to safely travel to the city and back, but you've got the cost of transportation there and back. You also got, if you're driving 3 or 4 hours away, you're going to go to that clinic. And I've heard this over and over again from patients I've had. Well, I was told that I have an appointment at 9 o'clock. And it's going to take me 2 hours to get there. So I get up, I drive, I get there at 8:30. I go in the clinic, and then I wait 4 hours before I'm seen. So you've got this family bringing in a loved one, waiting 4 hours to be seen because of just the chronic nature of the business. It just doesn't seem to work for scheduling for any. Very few doctors are good at that. And so now all of a sudden it's 1 in the afternoon. Now you you're seen, and by the time you're done, you're out there by 2. Now all of a sudden you've been without food. You want to eat. You need to eat, and then you need to drive back. It may be that the doctor orders tests, and this is a typical day for somebody in rural small town America. I'm going to drive to the city. I'm going to wait 4 hours. I'm going to see the doctor. The doctor's going to order tests and either tell me to come back the next day, or if I make a big deal about it, they'll try to get me in over at the hospital, wherever I got to get the diagnostics done. And then by the time I'm done with everything, it's so late in the day. I'm going to be driving by at night, and somebody's lost a day of work. It's just a huge expense. And a lot of times, poor people that don't have vehicles will end up having to pay somebody to take them down and to stay with them all day. So that might be $100, $150. They have to pay somebody to take them to see the go see the doctor. So having diagnostics available closer to home, county by county in these rural counties, would be very helpful. The question is, how do we do that? Do we have a diagnostic lab center that is in this county and like a 5 county area, and then you have a team that goes day by day or week by week from one to another till they cover that area. Or one thing that I've seen done well is we've had trucks, semi trucks, MRIs on a semi truck. We could do echoes. We could do all sorts of things. We could put them on trucks and maybe move truck from county to county in these rural areas and have a medical team that works from county to county. Maybe they take a week on and go in one county, one day in one county, another day, then has 7 days off to be home with their family. But there needs to be some way to deliver all these diagnostics. A lot of physicians in small towns are able to get help and be able to read and consult if they just have the diagnostic tools. And a lot of times what they're doing is they're sending people off just because they don't have the tools to accurately diagnose and assess what's really going on. So there's a lot we could do there in trying to get equipment into these rural areas more effectively. Another issue that I found, because when I was at one point I was wanting to open free medical clinics in one of the poorest areas of the country where I serve. I think it may be the poorest region of the country, a little bit ahead of Appalachia. I think it's neck and neck, parts of Appalachia and the Mississippi Delta, who's poorer. But what I found was I found doctors that were willing to come and volunteer and give time in the clinic. I found those that were willing to give the time. The problem is they were a medical doctor in one state, and it's hard to get a doctor to come in, even if they're going to do it for free and no charge. None of these state associations of physicians want any doctor coming from out of state to do charitable health care. So it's virtually impossible for organizations to provide quality medical care when you want to depend on volunteer physicians who maybe are retired, or maybe they live in a suburban or urban area and they say, hey, I'm going to give 1 week a year and I'm just going to go to a very poor area and I'm going to donate my time to a clinic. A lot of doctors will go overseas and do that now. They can go overseas and practice at some kind of like mission work, but trying to get those kinds of things organized here in the United States is very, very difficult. And if we could create a regulatory environment where well-qualified physicians and others can come from one state to another state or from one area to another area to operate free clinics that are very much underserved. And I understand that physicians don't want free health care everywhere because it would hurt their business. And the goal isn't to hurt the business of physicians that really are to bring them into a city where they're not needed. But we could all come to an agreement that there are certain areas in different states where there is not adequate health care. There aren't doctors really serving those areas, and those places are so underserved and would benefit from having a free clinic where a physician would come in to help periodically from time to time to help with various issues of managing chronic disease or help with diagnosing or doing annual physicals, in-depth physicals for people that wouldn't otherwise get one. There's a lot we could do in that area. I think the biggest challenge, though, is we as a society have got to decide that we value rural people, small town people, and we recognize the limitations of what they have access to, and realize that we need to get the right professionals and we need to get the right equipment and diagnostics into these areas to help with health care. And I think that would be a very good thing to do. Just simply having socialized medicine where the government provides that everything is paid for doesn't solve the issue of access. And that's what rural Americans face as their biggest struggle is accessing care. It's not about whether it's funded or not, it's about access. And I think we've got a lot that we can do in that area to make access more readily available to those in rural America.